Is sneezing a sign of coronavirus? Sneezing and runny noses are not common symptoms of COVID-19. For COVID-19 patients, congestion only occurs in 4.8% of cases, according to a WHO report. The most common symptoms are fever and a dry cough. Seasonal allergies can often bring with them cough and runny nose, but they also bring itchy or watery eyes and sneezing, symptoms that are uncommon in coronavirus patients. If you do not have any other symptoms, along with your sneeze, then it is highly unlikely that you have contracted the virus. If you are sneezing and have symptoms of the coronavirus, you should be self-isolating and contact your health provider.